Hello, everyone. Welcome to Backyard Musings, broadcasting live from Apple Valley. I'm Steve.
I'm Scott.
Thank you for joining us today. Strange segment today: yellow nail syndrome.
Yeah, if you haven't had anything to eat, you might not want to listen to this one. It's kind of tough.
A new study published December 23rd in the Annals of Internal Medicine identifies the planar cell polarity pathway as a significant factor in yellow nail syndrome. I'd never heard of this before this report here. Crazy.
I've heard of this.
You've heard of it.
Not to the detail that we're going to talk about. But
Do you have yellow? Do you have? I don't have yellow nails. Can you show?
No.
Well, show us.
No, I know people that do though.
Okay.
I know people that do though because a lot of people that smoke, especially cigarettes or cigars, have yellow nails.
Offering the first genetic explanation for the disease's development. This analysis, based on genetic sequencing and gene and protein expression data from YNS patients, provides the first evidence linking PCP pathway disruptions to the disease. I don't think PCP is the drug.
Are you sure? Okay.
Do you think it is?
I don't know. How many other things you know?
PCP pathway disruptions to the disease, particularly in its congenital form. Would you like? I want to know more.
We're gonna know more. Yeah, this is kind of weird. So, like I said, it's like a warning. Yellow nail syndrome is much more than stained nails, which is what I was talking about, I guess, with the nicotine. Yellow nail syndrome is a rare condition marked by three main symptoms: yellow, thickened nails,
hence the name. Yeah.
Yep. Lymphedema and chronic lung disease.
Wow.
So those are the three.
I've got a lung thing going on.
Do you?
The burn pits. Yeah.
Oh, okay. It can also cause fluid buildup and swelling in your lower legs.
I've had that too.
Yeah, I know some people
that have had too.
The most common sign of this syndrome is thick yellow nails.
I don't think I have that.
Yeah, no, yeah, I wouldn't shake your hand if you did.
Okay.
Your nails may also break away from your skin and fall off, which that would not be.
Well, that happened running on my toenails. When you train for a marathon,
well, I think
your nails fall off.
I think you can get this on your toenails or your fingernails, right?
Okay.
While its exact cause has long been a mystery, previous research has suggested that defects in lymphatic vessel development may contribute to the disorder. Experts don't know what causes yellow nail syndrome, but it may be linked to improper circulation. Could be from smoking,
Fingers.
Right? Issues with lymphatic drainage or buildup of fluid around your lungs.
Huh.
May also have a higher risk if you have one of a few specific chronic diseases, dental implants, or a joint replacement. I just got a dental implant this beginning of this year.
You did?
Yeah.
Huh.
However, the specific genetic basis of YNS, whether congenital or acquired later in life, has remained unclear until now.
Oh, here we go.
Yep.
Researchers from the Genetics Institute and Genomics Center, Tel Aviv Sourasky Medical Center, and colleagues studied genetic data from six patients.
Okay.
Come on,
it's rare,
man.
They said. It's rare.
6 patients. God, I was hoping for 600 or 6,000 with congenital. Well, not that they would be suffering from that. I wouldn't hope for that.
Right.
With congenital YNS and 5 with sporadic YNS to determine the genetic mechanisms underlying the disease. Among the patients with congenital YNS, their first symptoms appeared prenatally or shortly after birth. The median age for onset of symptoms for those with, what's the S again? Sporadic YNS was 12 years.
Oh.
Yellow nails and lung disease were the presenting syndromes in most patients with YNS. Wow.
Okay. The researchers examined next generation sequencing data for all patients with YNS to identify and analyze genetic variants. What is that? CELSR1 was highlighted as the principal candidate disease-causing gene with autosomal recessive inheritance.
So they inherited a recessive autosomal
gene. Okay.
Yeah. Huh.
The researchers found that all but one patient with congenital YNS has biallelic variants in CELSR1. The remaining patient had a heterozygous loss of function variant in FZD6. If y'all know what these things
I
stand
don't
for,
know. I
yeah,
mean,
let us know.
Stand for something.
We're
Part
just,
of the research.
we're just passing on the information here.
Yeah.
Both CELSR1 and FZD6 are core molecules in the WNT/PCP pathway. None of the patients with sporadic YNS had candidate variants in either CELSR1 or FZD6.
It's interesting. The researchers then extracted RNA. Well, we talked about that with the last one we talked about, one on the 31st of December, from all patients to assess the WNT-PCP pathway expression, and found that the pathway is disrupted both in chronic patients with genetic variants and to a lesser degree in sporadic patients with genetic defects. These results suggest a strong case for the involvement of WNT-PCP signaling and PCP defects in the pathogenesis of YNS.
Yellow nail syndrome develops most often in adults over 50.
Okay, that's me.
That's me. More rarely, yellow nail syndrome sometimes occurs in children. Some reports show higher rates of yellow nail syndrome in people with autoimmune diseases, cancer, nephrotic syndrome, rheumatoid arthritis, thyroid disease.
I probably got 2 of those out of those 5, somewhere in my body.
Go ahead. No, go ahead.
The hallmark sign of yellow nail syndrome is yellowish nails that curve and thicken. That would be wicked. Curve and thicken like talons. You may experience breakdown of your cuticles, the thin skin that protects your nail bed, nail curving, down or up, nail separation from your nail bed, that's painful, nail ridges, which I have nail ridges, we were talking about that, slowed or stopped nail growth, Mom. They grow, man. They grow.
They're growing.
Your healthcare provider will treat yellow nails. Oh, that's you. That's not me.
Oh, okay. That's okay. Your healthcare provider will treat yellow nail syndrome according to the suspected underlying cause or condition. For example, if they suspect improper lymph damage, then
drainage.
Lymph drainage, they may recommend specialized massage to help improve your circulation. If yellow nail syndrome is associated with excess fluid around your lungs, your healthcare provider may recommend a procedure to drain the fluid. Other yellow nail syndrome treatments may include vitamin E. You may take vitamin E supplements or apply a nail cream. That's kind of like what that lady wanted to do. Or gel containing vitamin E. Nail symptoms aren't usually reversible, but she was trying to get over on me. But vitamin E can slow or halt the progression of nail changes.
I'm running to the store and I'm going to get me some vitamin E.
Okay.
Totally.
Am I reading that one too?
I will.
Great.
Corticosteroids. You may use steroid creams to treat nail symptoms and reduce inflammation. Common options include fluoxetine, Lidex, hydrocortisone, cortisone 10, Locoid, lipo cream, or desoxymetasone, Topicort.
Antibiotics. You may take antibiotics such as amoxicillin, which brand would be Amoxil or Trimox, or Cefadroxil, which is a brand of Duracef, to treat a respiratory infection that keeps returning.
There's no guaranteed way to prevent yellow nail syndrome. If you have titanium implants, pay attention to symptoms that could point to yellow nail syndrome and see your healthcare provider if you have pain or discomfort. I wonder if those implants collect CO2 and that
they all use titanium
for the implants.
I mean, I've got one. I know some people.
Is it in your
complete
head?
Mouth replacement?
Oh,
no, it's a tooth.
Oh,
it's a tooth implant.
Yeah, they kind of drill them in, right?
Yeah, it's a little post.
Yeah,
and then they put a cap on it. But I know some people that have a complete mouth replacement. Every one of their teeth was pulled out and replaced with
drilled in stuff, or you talk denture.
Uppers and lowers.
Oh, wow.
Implants.
New choppers.
So that's that would be something you need to watch out for.
Yeah, you got to watch out. Go get your vitamin E, right?
Yeah.
If you have a relative who had problems with dental or surgical implants, speak with your healthcare provider about your risk before getting an implant. So
that makes sense.
Yeah, that makes sense.
And you'd think that bless their heart that they let you know up front. This is something you're going to need to come in and get checked on every once in a while.
Yeah.
So, and
I
maybe
guess
they do.
it's not on the radar. I mean, these doctors have thousands of things they have to memorize. My sister-in-law is going through halfway through medical school right
Yeah,
now.
but what are they going to do? They're going to wait for half your nails to fall off your hands or your feet?
Wow.
I mean, that's
And they're going to have to go
not
through the
good.
books and look and see what are the symptoms.
Yeah.
What
Gee,
could it
why
be?
did this happen? Oh, that's right. We had an
We got a titanium
implant.
implant up
Yeah,
there.
that's.
How do you?
Give me a break.
It's crazy how they make those connections. Anyways.
Yep.
All right, folks. Thanks for joining us on Yellow Nail Syndrome Day.
Yeah,
We'll
we
talk
don't
to
want
you.
to talk about that one anymore. Take care, everyone.
See ya.